Colon cancer kills more than 53,000 people in America every year, about an equal number of men and women, making it the second leading cause of cancer death in America. Every year it kills more people in our country than HIV, AIDS, and breast cancer combined. But it doesn't have to be that way. Few cancers are as preventable as colon cancer. On today's show, we'll tell you what you can do to guard against colon cancer. We'll tell you about a new collaboration between the Department of Public Health and Wellness, physicians, and hospitals throughout our community. We'll talk to someone who has taken advantage of this new partnership to get screened for colon cancer. We'll also talk to someone who has survived colon cancer because of early screening, detection, and treatment. But first, we'll give you a quick roundup of all the latest news at the Department of Public Health and Wellness. So stay tuned. We'll be right back. More than 3,000 children and adults participated in this year's Walk on the Waterfront on May the 13th. It marked the 10th anniversary for this event. This year was the biggest turnout ever, with nearly 3 times as many participants as in any previous years. Elementary school children from the Health Promotion Schools of Excellence and Public Health and Wellness staff walked from in front of our Gray Street headquarters through Louisville streets and along the Ohio River on this 2-mile hike. Walk on the Waterfront encourages walking as a healthy habit among children and adults. U.S. Congressman John Yarmuth has secured a total of $583,000 in federal funds for 3 Department of Public Health and Wellness projects. A new mobile health dental unit will be funded with $243,000. The unit is in addition to the mobile health clinic presently used by the Department of Public Health and Wellness. It will bring dental screening to children and adults in underserved areas of our community. The Center for Health Equity will also receive $243,000 to carry out its work. This funding will be used to develop further research and educational programs. It will also fund campaigns to further awareness of health inequities. The Louisville Men's Health Project will receive $97,000. The initiative will explore ways to bring health services to men and will undertake initiatives for obesity prevention, dental care, stress reduction, violence prevention, and conflict resolution.
When an emergency operation leads to bankruptcy, when donut holes drive up the cost of crucial medication for our seniors, that is a major crisis. We have to work toward a day when healthcare is no longer a luxury for the privileged few, but a right for all.
More than 2,400 people have taken advantage of free health screenings offered by the Metro Department of Public Health and Wellness. The comprehensive battery of screenings valued at $1,400 was offered at no cost to the residents of West and Southwest Louisville neighborhoods. More than 34% of those screened reported having no health insurance. This compares to an overall rate of 15% of the Louisville Metro population with no health coverage. The Department of Public Health and Wellness is now following up with those who were screened to make sure that they have access to health care for the conditions that were identified. The department will issue a full written report to the community very shortly. A recent study done by the University of Kentucky researchers shows a 97% improvement in the indoor air quality in Louisville workplaces, bars, and restaurants since the enactment of the comprehensive smoke-free law.
When we collect these data, we use a small machine. It's called the side pack, and it's right here. Hold it up. It's very small, and there's a tube. And we send research assistants into these venues. The side pack has a built-in sampling pump that draws air through the device, and the particulate matter in the air scatters the light from a laser.
This study stands in sharp contrast to a similar study done shortly after Louisville's previous partial smoking ban went into effect in 2006. That study showed that the partial law had little effect on removing toxins in the air.
From our side, this is a public health dream. There are an awful lot of laws that we put in place and have been in place for a long period of time when we never get a good chance to really see scientifically, in terms of numbers, in terms of proof that what we're doing makes a difference.
Well, that's the Public Health and Wellness News. Stay tuned. We'll be right back.